GI anatomy, the pectinate line. All right, so the pectinate line is its own video because a lot of my buddies struggled with this idea of the pectinate line, but I'm going to hopefully break it down so that you fully understand what's going on because it's a very high yield topic that's questioned a lot. So the pectinate line is important because it tells you kind of the difference between the inside of your body and the outside of your body. So this is the direct point in which your body decided that this is going to be the inside and the rest is going to be outside. All right, so that is what the pectinate line is in kind of layman's terms. So above the pectinate line is going to be essentially your internal organs, your internal GI structures. Okay, so it's still considered your GI tract. And so above the pectinate line to me is so easy because since it's still considered the GI tract, that means it's considered the hindgut, right? Because it's the end of your GI tract, so it's still a part of the hindgut. And since you know that it's still a part of the hindgut, then you already know the arteries and veins. The arteries are going to go for the IMA, right? So your IMA provides blood flow to the above the pectinate line, okay, via the superior rectal artery, okay? But it's just a branch of the IMA. It's very easy. And then for the vein, the blood's going to drain above the pectinate line via the IMV, the inferior mesenteric vein, right? Because it's still a part of the hindgut, okay? And then it's going to drain into the portal system, the portal vein. All right, very straightforward. Once again, very easy. Now, the lymphatics are going to drain into the internal iliac because this is going to be your internal organs. So all the lymphatics are going to drain into the internal iliac lymph nodes. That's something that you probably are just going to have to memorize if you don't really understand the anatomy of the lymphatic system. But if you understand the anatomy of the lymphatic system, it should make sense, okay? And then lastly, the nerves that are supplying it, it's going to be visceral innervation, okay? And this is key because obviously, you're not going to have somatic innervation above the pectinate line because above the pectinate line, once again, it's just considered the GI tract. So imagine for a split second that your whole GI tract was somatically innervated. You would be able to feel your GI tract. That would be horrible. So hence, anything above the pectinate line is going to have visceral innervation. It's easy. It makes logical sense. Now, let's talk about below the pectinate line. Since below the pectinate line is going to be your outside, okay, it's going to be innervated by it's going to have somatic innervation by the pudendal nerve, right? Because the pudendal nerve, as we know, supplies innervation to our genital area, our anogenital area. And since it's kind of like the anal area, it's going to be supplied by the pudendal nerve, somatic innervation, right? Because it's outside. Imagine it being just like your skin. It no longer is your GI tract. You have feeling in that area, and that feeling is due to the pudendal nerve, okay? And it's below the pectinate line. Now, also below the pectinate line, what do you think is going to happen? Well, anytime you're talking about the genital urinary system or like kind of just pretty much all of the GU tract, all of the GU organs, the anus and the penis, the vagina, they all are supplied by the pudendal artery. So this is no different. Since you are now near that area below the pectinate line, the artery supply is going to be the inferior rectal artery branch of the pudendal artery, okay? Now, for the venous drainage, what you have to know is that it's going to drain into the IVC. It won't drain into the portal vein because it's not a part of the GI tract anymore. It's just going to drain, like the rest of the blood, into the systemic system. It doesn't have to go through the portal system anymore, okay? And that will just be like the pudendal vein, okay? And then lastly, for the lymphatic system, what you have to memorize is that's going to drain into the inguinal lymph nodes, the superficial inguinal lymph nodes, all right? So that's the key differentiation here. Above the pectinate line is just like your GI tract. It is essentially the end of your hindgut. It is your hindgut. So the innervation is going to be visceral, like all of our internal organs. The arteries and veins are going to be your IMA and the IMV. Very easy. And the IMV is going to have to drain into the portal vein at some point. And then the lymphatics is going to be the internal iliac lymph nodes. Whereas below the pectinate line, it's essentially the anus, right? So it's going to be supplied by the pudendal artery, and it's going to drain into the pudendal vein and go right into the IVC. It doesn't have to go into the portal system, right? And it's going to have somatic innervation by the pudendal nerve below the pectinate line, and it's going to drain into the superficial inguinal lymph nodes. All right? So remember the lymphatics. They like to test on the lymphatics, and they love to just in general test on the pectinate line. Now, there's some pathologies associated with the pectinate line, specifically hemorrhoids. So what you need to know, above the pectinate line, you have internal hemorrhoids. Okay, so internal hemorrhoids are pretty much abnormal. Hemorrhoids in general is abnormal distension of like veins. Okay, and the fact that these are above the pectinate line make them internal hemorrhoids, and so it's going to be abnormal distension of the anal venous plexus. Now, a key differentiation between the internal and external hemorrhoids is that internal hemorrhoids are not painful. Okay, these are not painful. And can you guess why? Exactly. You're above the pectinate line, so the innervation is visceral, right? You don't feel your organs, so you're above the pectinate line, and so these internal hemorrhoids are not going to be painful because it's a visceral innervation, all right? So remember that the internal hemorrhoids, it's essentially just distension of the IMV branches, right? Inferior mesenteric vein branches, okay? And they're not painful. Now, you're going to see an increased risk with constipation for internal hemorrhoids. Now, below the pectinate line, you have an increased risk of two things: external hemorrhoids and anal fissures. First, external hemorrhoids. Remember, this is going to be below the pectinate line. So the key difference here is that it's it's a somatic innervated by the pudendal nerve. So you're actually going to feel it. So it's going to be extremely painful. And that's going to be the difference between internal versus external hemorrhoids. Okay? External hemorrhoids are going to be painful if they're thrombosed, right? Now, for the anal fissure, an anal fissure is just a tear. So rather than a distension of like the venous plexus, an anal fissure is actually a tear to the mucosa, and it's going to be below the pectinate line. Well, since it's below the pectinate line, once again, it's going to be painful. And it's going to be painful with pooping, right? Because the blood is going to, or the bowel is going to pass through that through that anal fissure, and it's going to cause pain while it passes through. Okay? What you need to know is that you can also cause severe bleeding. So you can see blood on the toilet paper. Okay? And the most common location, although you might think that this is lower yield, but I got a question on it. The most common location for anal fissures is going to be the posterior midline. Okay, the posterior midline of the anus. If you see like some type of a scratch there or tear there, that's an anal fissure. Okay, and the most common area is the posterior midline below the pectinate line. It's associated with a low fiber diet and constipation as well. So you want to give the patients some type of fiber supplementation. All right, so this is our pectinate line and the associated pathologies. Please just remember this. It's so high yield, and it's just so easy to understand. If you have questions with it and you struggle with the pectinate line, let me know. Don't be embarrassed, because all my friends, honestly, they struggle with the pectinate line so much. So if you have any questions, please let me know and reach out. Don't forget the lymphatics. They ask about lymphatics.